Have you noticed that your legs still feel weak, stiff, or unsteady even if you eat right and stay active? You're definitely not alone. For many older adults, leg weakness isn't simply about aging or lack of exercise. Often, the hidden cause is certain vitamins quietly working against your body. Surprisingly, some of the most common supplements when taken incorrectly or in excessive amounts can damage nerves, weaken bones, and reduce the muscle control needed for daily movement. In this video, we'll uncover 5 vitamins that may silently undermine your leg strength and what safer options to consider instead. This is information you don't want to miss. Share in the comments where you're watching from. And don't forget to subscribe to Health Lab for more essential tips to keep your legs strong and your future active. Let's begin with vitamin E. Taking vitamin E in high doses has been shown to reduce muscle strength, injure nerves, and raise the risk of balance problems in seniors. Doses above 300 milligrams per day, roughly 400 to 800 IU, offer no clear benefit for mobility, but may cause harm when used long-term. Clinical reviews have documented that large amounts of vitamin E are associated with fatigue, muscle weakness, and loss of endurance in the lower body. According to U.S. Pharmacy References and the Merck Manual, people using excessive doses often report low energy, soreness, and difficulty maintaining strength. These problems don't occur with normal dietary intake, but emerge once supplements exceed recommended daily limits. Excess vitamin E also disrupts communication between nerves and muscles. Research suggests that prolonged overuse can contribute to mild peripheral neuropathy, reducing sensation in the legs, slowing reaction times, and impairing balance. Although vitamin E is important for protecting nerve tissue at normal levels, excessive amounts appear to interfere with nerve signaling, making movements in the feet and legs less controlled. Megadoses of antioxidants, including vitamin E, have not been shown to improve physical function in seniors. Randomized trials involving older adults with adequate diets reveal that high doses do not strengthen muscles or lower the risk of falling. A meta-analysis published in Annals of Internal Medicine, 2005, even found that adults consuming more than 400 IU daily had a slightly increased risk of death compared to those who consumed less. These findings raise serious concerns among medical professionals about the long-term safety of high-dose use. Another often overlooked danger is vitamin E's effect on blood clotting. At high levels, it interferes with vitamin K, which is necessary for normal coagulation. This raises the risk of internal bleeding. In some cases, high-dose vitamin E has been linked to hemorrhagic stroke, a bleeding event in the brain that can cause sudden paralysis, loss of movement, or even death. For seniors, even minor internal bleeds can dramatically impact leg strength and independence. The established upper safe limit for vitamin E is 1 0 mg per day, about 500 IU. Yet most guidelines recommend far lower intakes around 15 mg 22 IU per day, because higher levels provide no added benefit and carry unnecessary risks. The challenge is that many over-the-counter supplements contain 200 to 10 IU per capsule, which makes it easy to surpass safe thresholds without realizing it. Older adults are especially at risk from excessive supplementation. As muscle naturally declines with age, any nutrient that disrupts nerve function, reduces circulation, or increases fatigue can quickly accelerate leg weakness and limit mobility. To maintain strength and balance, seniors should avoid high-dose vitamin E unless specifically prescribed by a doctor. Getting vitamin E from food sources like sunflower seeds, almonds, spinach, and vegetable oils is generally safe and beneficial. Always review supplements with a healthcare provider to confirm that the dosage is both appropriate and safe. Number 2. Vitamin A. Excess intake of preformed vitamin A, known as retinol, can significantly weaken bones, heighten fracture risk, and reduce mobility. Seniors are particularly vulnerable since bone density naturally decreases with age. When too much retinol is consumed, the normal balance of bone remodeling shifts. Instead of promoting growth and repair, the body speeds up bone breakdown. Clinical evidence shows that long-term overuse of vitamin A contributes to thinning bones, stiff joints, and inflammation in connective tissue around the joints, all of which undermine the stability of the legs and hips. Large-scale studies confirm the danger. One Scandinavian trial found that people consuming more than 50 IU daily had double the hip fracture risk compared with those who averaged less than 600 IU. Similarly, the U.S. Nurses Health Study, which tracked over 70 postmenopausal women, revealed that participants taking more than 10 IU a day had a markedly higher likelihood of hip fractures compared with moderate users. These results prove that excessive retinol intake damages bone strength, even in otherwise healthy individuals. For older adults, fractures are especially serious. A broken hip or leg can require months of recovery, often leading to loss of independence or permanent mobility problems. Even without a fracture, high vitamin A levels can trigger chronic issues such as leg weakness, pain while walking, and difficulty climbing stairs. Both animal experiments and human case studies demonstrate that too much retinol reduces bone thickness and can even cause spontaneous fractures without injury. Over time, this decline in bone quality makes it harder to bear weight, maintain balance, and move safely. While the damage may not be obvious immediately, months or years of high intake can quietly erode leg strength and increase the chance of serious falls or injuries. The established upper safe limit for preformed vitamin A is 30 micrograms per day, or 10 IU. Many multivitamins already supply 530 IU, and additional intake from foods like liver, fish oils, or fortified products can easily push totals past that threshold. Because vitamin A is stored in the liver and not quickly eliminated, the excess builds up over time. Unlike water-soluble vitamins, the body cannot flush out large amounts efficiently. While deficiency can cause problems, excessive intake is far more common among supplement users. For seniors, high-dose retinol supplements should be avoided unless prescribed by a doctor. Instead, beta-carotene, the plant-based form of vitamin A, is considered safer, since the body only converts as much as it needs. Number 3. Vitamin B6. Vitamin B6 is essential for maintaining healthy nerves, yet when consumed in excessive amounts, it can actually harm the very system it is meant to protect. Prolonged use of high-dose B6 supplements has been strongly linked to peripheral neuropathy, a form of nerve damage that often begins in the feet. People who take too much over several months may notice tingling, numbness, or burning sensations in their legs. Others describe the feeling that their feet are constantly asleep or that they've lost awareness of foot position while walking. At first, these symptoms may seem minor, but if ignored, they can progress to severe disability. Scientific studies consistently show that long-term intake of 300 to 500 milligrams of B6 daily can cause serious issues, such as poor coordination, difficulty walking, and loss of balance. In more advanced cases, individuals develop a wide, unstable gait and may eventually require assistance just to move around. Unlike deficiency problems, these symptoms are caused by excess intake overwhelming the nervous system. While stopping supplements can sometimes improve the condition, recovery is often slow, and for older adults, nerve repair may remain incomplete. Seniors already dealing with mild nerve impairment from diabetes, circulatory issues, or past injuries are especially at risk of permanent damage when B6 intake is too high. The recommended daily requirement for adults is modest, about 1.5 to 1.7 mg. The official safe upper limit is 100 milligrams per day. Despite this, many energy boosters or nerve support supplements provide far more, often exceeding 200 milligrams in a single capsule. Some users unknowingly take these daily, not realizing they're pushing well beyond safe levels. Even doses lower than the maximum can trigger symptoms in sensitive individuals, particularly with prolonged use. Unlike certain nutrients that accumulate gradually, B6-related nerve damage may appear suddenly. One day, walking feels normal. The next, your legs may feel weak, unstable, or unresponsive. The warning signs are easy to spot if you pay attention. Pins and needles sensations in the feet, loss of balance in low light, frequent stumbling, or difficulty sensing leg movement during walking. These aren't natural signs of aging, they are clear indicators of vitamin toxicity. If ignored, they can lead to dangerous falls and lasting mobility loss. To protect leg health, older adults should steer clear of high-dose B6 supplements unless specifically prescribed and closely monitored by a physician. Normal food sources such as poultry, bananas, potatoes, and fortified cereals provide safe and sufficient amounts. Supplements, especially those taken for longer than a few weeks, should always be reviewed carefully to avoid hidden risks. Number 4. Vitamin D. Vitamin D is vital for bone health and proper muscle activity, yet taking too much over a long period can actually create serious problems. Excessive intake raises calcium levels in the blood, a condition called hypercalcemia. This directly affects muscle function, including the muscles of the legs. The first signs of vitamin D toxicity are often fatigue, cramping, and noticeable weakness, especially in the lower body. People may feel a heavy sensation while walking, experience calf tremors, or wake up with painful nighttime spasms. Medical research has shown that high vitamin D intake interferes with normal muscle contraction and relaxation. Elevated calcium levels also disrupt nerve signaling, which in turn impairs coordination. Seniors on high-dose supplements frequently describe feeling unsteady when standing up, navigating stairs, or walking on uneven ground. In severe situations, this imbalance can lead to falls, loss of independence, and even hospital stays. One large trial in older women demonstrated that an annual megadose of 500 IU of vitamin D actually increased fractures and falls instead of preventing them. Other studies highlight that giving more than 4 IU daily over long periods adds no extra bone benefit but does increase the likelihood of complications. These results challenge the assumption that higher doses always mean stronger bones. Beyond skeletal issues, hypercalcemia caused by vitamin D overload can produce nausea, kidney strain, confusion, and most dangerously, impaired muscle control. When calcium deposits accumulate in soft tissue such as muscle, their function is compromised. In the legs, this can appear as stiffness, weakness while climbing stairs, or a dragging, unsteady gait. The safe upper limit for adults is set at 40 IU per day. Yet many supplements contain 50 IU or more in a single pill. Taking these daily without medical guidance can gradually push blood calcium into a harmful range. Seniors with kidney disease, low magnesium, or dehydration face an even higher risk of complications. Since muscle mass and strength already decline naturally with age, piling on excess vitamin D only worsens the likelihood of weakness, imbalance, and injuries. In the worst cases, a nutrient that should support mobility ends up becoming an obstacle. To maintain leg health, older adults should aim for consistent but moderate intake. For most, 800 to 10 IU per day is sufficient, unless blood tests and a physician's advice indicate otherwise. When it comes to vitamin D, more is not better. The key is staying within the healthy range. Number 5. Vitamin C. Vitamin C is widely praised for boosting immunity, but in excessive amounts, generally above 20 mg per day, it can quietly create more harm than good. Many people believe water-soluble vitamins are always harmless since the body flushes out the excess. Yet with chronic overuse, high-dose vitamin C supplements can disrupt mineral balance and connective tissue health, ultimately undermining muscle and joint strength. One of the biggest concerns is its effect on copper levels. Large doses of vitamin C impair copper absorption in the digestive tract, Copper is a trace mineral critical for strong blood vessels, nerve health, and proper collagen production. Without enough copper, connective tissue becomes weaker, leading to compromised tendons, ligaments, and joint stability, all essential for steady legs and smooth movement. Research shows that copper deficiency triggered by prolonged vitamin C overload can result in joint pain, delayed wound healing, and even bone changes resembling osteoporosis. In seniors, this often appears as knee instability, slow recovery from minor injuries, or persistent soreness in the ankles and hips. Copper also plays a vital role in nerve transmission and repair of the protective myelin sheath. If copper levels fall too low, nerve signals to the legs can become sluggish or irregular, producing numbness, heaviness, or declining coordination. These symptoms are often dismissed as aging or circulation problems, but in many cases they stem from nutrient imbalance. Another recognized risk of long-term high-dose vitamin C is kidney stone formation. While not directly tied to leg strength, kidney stones can cause dehydration and disrupt electrolyte balance, both of which contribute to leg cramps and spasms. These muscle problems often strike at night, disturbing sleep and slowing recovery in older adults. It's important to remember that vitamin C from whole foods like citrus fruits, berries, bell peppers, and leafy greens is highly beneficial. The trouble begins with supplements in extreme doses. The recommended daily amount for adults is just 75-90 mg, and the tolerable upper limit is 20 mg. Yet many effervescent tablets, powders, or immune boosters provide 10 mg or more per serving, and some people take them several times per day without realizing they are far exceeding safe limits. Over time, this habit can contribute to leg discomfort, mineral depletion, and reduced joint resilience. Seniors already facing bone loss or declining connective tissue are particularly sensitive to these side effects. To protect leg health and mobility, it's best to rely primarily on food sources of vitamin C. Whole foods not only provide this nutrient, but also deliver antioxidants, fiber, and phytonutrients that enhance absorption and support balance. If supplementation is necessary, it should remain within safe ranges and be reviewed by a healthcare professional. Not every vitamin is harmless, and even common ones can backfire if misused. The issue isn't only what you take, but how much, how often, and under what circumstances. These nutrients can either preserve your independence or gradually chip away at it. The smartest move you can make today is to talk with your doctor, check your nutrient levels, and review your supplement routine. What helps someone else may not be right for your body. With the right knowledge and the proper dose, you can safeguard your legs, your balance, and your freedom of movement. So tell us in the comments which vitamins are part of your daily routine. Share your experiences. We'd love to hear from you. And don't forget to subscribe to Health Lab for more expert advice on keeping your legs strong and your life active, one step at a time.